Hello, I'm Emma, founder of Nurse Fern, your source for remote and alternative nursing jobs. Today, I get to interview a nurse who not only works remotely as a nurse coach, but helps other nurses set up their own independent practices. I'm excited to welcome Carrie Bruno of the Mama Coach today. She's a nurse coach and entrepreneur. I've been fascinated by learning more about her business because it's quite unique. The Mama Coach is a network of 150 plus RNs and NPs who practice independently and offer services for families guiding through every stage of the parental journey through non-judgmental, evidence-based education and support.
Hi, thank you so much for having me.
Do you mind starting off by sharing a little bit about what your nurse origin story is?
I think I have a common nurse origin story. I've wanted to be a nurse for as long as I can remember. Healthcare and serving and helping people always intrigued me from a really young age. And I've been a nurse for 18 years and always felt drawn to women's health and maternal child health and loved it. I loved every single second of it. I've worked in labor and delivery. I worked permanent nights for a long, long time. And I think the shift in my nursing career really happened for me when I had children. I have two boys. I love nursing like with my whole heart. It's such a part of who I am. But then I had these two boys that I loved with my whole heart too. And so I bet I know other nurses feel this way. I would go to work and I felt like I was missing a piece. But then when I was home, I also felt like I was missing a piece. So I'm like, there has to be a way. Here I am already digressing. You asked for my origin story and I just dive in.
I'm eagerly following you digressing because I was reading on your website about how you switched to permanent nights so you could spend more time with your boys.
I just felt so fried. I loved my job, but I was just doing okay because probably there's lots of people who do this. They take on night shifts and then skimp on sleep to be with their family or to do other things. And I had done that for a long time once I had my children and I was running out of steam. I cried at my kitchen table when I told my husband, I'm like, I'm trying to imagine what life will look like for me in 10 years, and it can't be this. I didn't want to leave my profession. And so I tried really hard to like other jobs for a while. I shifted to a day position in the operating room, which is an incredible job. And I'm so in awe of the nurses who work there. I just missed the connection piece. Like that's when I think about nursing, that's a huge part of how I define it is the relationship that I get to build with people. And it's just a different kind of relationship. So I'm like, okay, no, that's not it. And I don't want to leave the profession. So now what? My husband actually was an entrepreneur before me. And so for years, I watched him grow his business. And I thought, you know what? What if I could do nursing in this capacity? What would that look like? And so my wheels got started spinning and I literally built it myself from the ground up, not knowing really what I was doing, but it grew quickly. Within 9 months, I was able to drop from full-time nursing to PRN. There's a huge gap in our healthcare system when it comes to providing education and support. I think it's because our healthcare system globally is really overwhelmed. Like we're swimming really hard just to treat disease and try to maintain health. There isn't a lot of space for health promotion, health prevention, true education and support, walking alongside families. And I think it's refreshing. It was refreshing. It is refreshing for families. And that's why it grew.
And what you're building on the side was that you as a solopreneur in the Mama
Yeah.
Coach?
Yeah, and so it was just me for the first few years. So I figured out the electronic medical record and the legal liability waivers, and then the programming was me doing the research. I still do that, is the evidence-based and checking the guidelines and building the content, figuring out the website, all the moving parts. So I did that on my own for the
That's
first.
really hard to do on your own.
It is, but you know what? I think our nurse brains are wired for a lot of things. I don't think nurses give themselves enough credit for the parallels that come along with our skill set.
What was the
Multi
hardest thing for you to figure out at the beginning?
I would say confidence. So I've been a nurse 18 years and I started the Mama Coach. Oh man, I got to do the math. 8 years ago. So I'd been a nurse for 10 years. I had confidence as a registered nurse, but I also was used to being kind of within the healthcare system. And there's a hierarchy in the healthcare system. I had to learn the skill of representing myself as an independent practitioner. I had to get out of my own head. So when I was going out into the community to build referral networks, gaining the confidence to say, I'm a nurse, I work for myself, this is what I do, and this is how I can help your practice, and this is how I can help your patients. That took time and practice and me working on my confidence and true belief. Our scope is so much bigger than we think it is. When it comes to teaching, it's big.
I think that is yeah, I anticipated you to say something that was very hands-on, nitty-gritty, like researching
Yeah.
something, but
Yeah.
I fully agree with what you're saying there. It is really easy to not do something because you question whether you belong in that space.
That's right. It's a forever process, I think, as humans, kind of learning how to step outside of our comfort zone, right? And take a deep breath and do something that excites us, but also intimidates us. And I keep referencing the healthcare system, but it is a learning for a nurse because we are kind of used to, yes, our scope is very big and we're so educated and we contribute so much, but there is that kind of mentality of doctor's orders and things like that is different in independent practice because of course we practice within our scope, but it's ours. It's education and support. It's us assessing the family. It's us determining when there needs to be a referral. And I think with time, as practices grow, we gain confidence, seeing like, the outcomes are so good when a nurse is like steering the ship.
You started off as a solo entrepreneur. How does this leap look from being solo to going into the Mama Coach network? Because
Sure.
150 practitioners is a lot of people to have with you.
It's actually multifaceted. The first was I only had so many hours in the day, and I was like booking, weeks out, trying to see family. So I thought, oh, this is bigger than me. I thought, oh my goodness, everybody needs a nurse in their community who can provide the kind of care that I'm providing. So that was the first thought. The second side of things was the nursing side. I have colleagues, right? I have friends for years that have worked in the healthcare system. The expectation in our healthcare system is for nurses to give and give and give and give, and we do, but at the expense of our own health, our families. It's not a sustainable thing. I know how much better I was feeling after getting to sleep in my bed at night, and I truly had more time to care for myself, but I was also giving really incredible care to the families that I was serving. And I thought, other nurses deserve this too. There is a different way to use our nursing skills, and it can look like this. Life can look like this. I think it was the client that I saw the need, but I also saw the need for nurses. So that's how the licensing model came to be.
And what does it look like now?
We're a license-based model. So what that means is each nurse is 100% owned, like her practice is 100% owned by her. I don't take like a percentage of her revenues or anything like that. I describe it as like being in your own business, but not on your own island. And so I'm really proud because we give incredible care, but we've also created a community, a really healthy community of nurse colleagues, because the reality is I think even that relationship can be strained because of the healthcare system, because there's so much work, not enough staff, and the dynamic is hard. But here we're friends, we're online, we're all over the place. I've silenced my computer, but normally it dings all day long because it's nurses talking to one another. We take the best parts, we work independently, but talk about challenging client cases and marketing ideas. We've really grown as a team, and I think our programming has expanded too. Our vision is to be this one-stop shop for families as their babies grow, and our last program was potty training, and then our next program that's launching in early spring is actually focused on the woman. We're building the programming for perimenopause and teaching women, how do they advocate for themselves? What is best practice in treating the different symptoms that can come on in late 30s, early 40s? Women are having children later. Like, this is coming up and getting a lot of questions about it. So we're just always changing and looking at ways to serve families better.
I didn't think when I initially looked at your information about taking the education to perimenopause and like the late motherhood.
Well, it's super interesting because we all have our own take on our practices all look different. You don't have to do all of the programming. Some nurses are like newborn experts, some are potty training, some are nurse practitioners that do telemedicine and they see families. Some are women's health practitioners. Some will just do perimenopause. That's the beautiful thing, is that they're serving their community, but they're also serving their passion, which is going to be what makes them love their practice in 10 years.
I'm a little jealous right now that like you have this built-in community within. That's like the loneliest thing about being an entrepreneur or a solo nurse coach.
I resonate with what you're saying because I did it on my own for the first few years, and that was the part I missed the most, was community. A huge part of nursing is nurses and how we work with one another. And I bet you felt it too, where you make the shift and you're working independently and you don't realize how much you bounce off your colleagues until you don't have colleagues.
Mm-hmm.
And so I appreciate that part of our community. And I think it's also about always making sure that we are moving forward. So we have a nurse, one of her key jobs is to make sure our content is updated. We have different sets of content depending on where you live because the guidelines are different. So some nurse will be like, hey, Carrie, did you see this research paper? And I'd be like, oh my goodness, no. Like, we're just such an incredible group of nurses, always making sure that our content is like top notch.
My brain swirls a little bit knowing how much you have that you offer content wise and then keeping it up to date with the research and evidence base.
Yeah.
That is a lot to keep up with.
It is a big job, but an important one. You know, if we're going to take on this role of supporting families in this capacity, we have to make sure that our stuff's up to date.
What is one of your favorite stories to come out of the Mama Coach and working with other nurses and bringing them into this?
Some nurses I work with, they're like, Carrie, I want to make 6 figures. This is what I want to do. This is my goal. Perfect. And we have nurses who do that, and it's incredible. But then we also have nurses who are like, Carrie, I want to work with a nonprofit. This is what I want to do. I want to find the grant funding. And I'm like, awesome, let's do it. Like just today, I got an email from a nurse who just started. She started with us at the end of June, and she wanted to let me know that she just went back over her 3-month goal and she exceeded it by a long shot, and she just started. Like, she told me she's already, like, in 3 months she saw 20 families, which is awesome. It's just cool to see everybody gain confidence and meet their goals, whatever their goal is.
It is a really good feeling when you know other people benefit from what you're putting out there.
As they grow, families are benefiting, communities are benefiting. Nothing bad is coming from a nurse growing a beautiful practice, because the outcome is better health outcomes for families.
Are there mama coaches globally?
No. So currently we're in Canada, the United States, the United Kingdom, Australia, and New Zealand. And you know what's interesting is that nursing challenges are very similar wherever you live.
Do you have like a certain number of mama coaches that you let function in each area?
I'll use the United States as an example. The license to use the trademark and all of our programming forevermore is for the United States. If you move, your practice would just move with you. The goal is to not have more than one mama coach per 300,000 people. We're like not anywhere near that. We're just getting started. I chose that number because I believe that we can serve a number like that well in a practice and build a full-time practice if that's what a nurse wants to do. It preserves our community because we have such a collaborative nursing community. I'm not interested in changing that and having us like compete with one another, because that would change things.
Somebody moves, it's not a big deal. They just take their practice.
That's right. Most of us have a hybrid model. So we do some in person and some online. If you build an online community and you move or you go on vacation, you just continue to serve the online community. And that was a big shift with COVID. People are very comfortable with accessing healthcare this way. And so we have nurses who have strictly online practices like myself. So I still see families once a week, but I do everything online.
And you have an upcoming cohort. Can you
Yes.
share a little bit about like what the application process is and onboarding
Sure.
for a nurse who wants to become part of this community?
Like on my website, you can find the application, you apply, and then I send an extensive webinar because I want to share all details about like everything that it entails. To determine if you're qualified to be a mama coach or not, you need to be a nurse, obviously. A nurse, a registered nurse or a nurse practitioner. You need to have some experience because that confidence piece, you need to be able to practice independently. I am looking for nurses that have strong assessment skills because I can teach you. Think about how many times we've shifted departments over the years. We do it. This is no different. I can teach you. I'm also looking for emotional intelligence because if you think about it, like sometimes I feel like a chameleon when I'm dealing with families because what somebody needs from me is different than the next person. And we all know the nurse who has one approach regardless of her patient, and the outcomes aren't as good. Those are the things that I'm looking for, plus the desire to work autonomously. And that doesn't mean you can't be nervous, because I think all people are nervous to try something new, but feel ready to put themselves out there and create something that's their own. So you apply and then we talk about it. You know, it's like, are you a good fit? Am I a good fit for you? And if so, then we get started. We do like all the logistical stuff first. So I'll help you set up your business. We got to get you a business bank account, connect it to your website, build your EMR, personalize all your legal liability waivers. There's some foundational learning to do. Then we do the training, and then it's 8 weeks of mentorship. And that's, in my opinion, truly where the magic happens, because you're going to start your practice and then let's decide, let's hear it. What's your goal? What do you want to focus? And then we're going to help you build a marketing strategy around it and then work on it over those 8 weeks. I describe it as a long-term relationship because it doesn't end after the 8 weeks. Like we meet every other week for business coaching where we come together, we talk, we teach something. I'll teach you something like email marketing or Google ads or whatever. And then we talk about what's going on in your practices. Like just last week, one nurse she wants to build a postpartum support group in her community. So we talked about it as a group. There's that long-term feeling of support, which I think is important. And then professional development. We meet once a month for learning.
I'm still just in awe of how much support everybody is getting that's a part of this. Like it's like a mastermind, but a business coach, but clinical
And it's what
CEUs.
all nurses need. And I think it's what's
Mhm.
missing from our profession right now. Like I said, healthcare is just trying to keep their head above water. I saw the better way of building a community, making sure the culture stays healthy, fostering people's independent practices, all while continuing to learn.
And you covered a couple important things that I know were questions that came in today, but you don't have to be mother baby OB nurse to get
No,
into this.
no, no, not at all. Like, for example, like the perimenopause program that's coming, you know, you can focus solely on that. You could be an OR nurse that loves babies, but you never worked there.
Can you share a story of like what an OR nurse has come in and done with the transition?
I see this happen from time to time often, where OR nurses, like they have babies or cardiac nurses or ICU nurses, I think a nurse who has children, of course, our natural tendency as nurses is to think about it through the lens of a nurse, right? How could I fill these gaps that I'm seeing with my own motherhood experience? That's what happens often. And so then I just give them the tools. Here's the assessment. Here's the programming. Here's how we help these families. And then let me help you help them in the background. Like there's that mentorship component. So it's not like you have to just go and do this with no experience. It's that.
And if somebody gets denied when they apply, should they try applying again for the next cohort?
It's always a conversation. Like I'll send an
Yeah.
email. Often it's brand new grads. It's not necessarily maybe the best thing to just bust right into private practice. Like I just want people to, like I said, those strong assessment skills, that desire to work independently, and emotional intelligence. I'm willing to have a conversation with anybody about it, and let's talk about what would it take for you to start a practice.
What do you do if social media is not your thing?
Anyone who follows me on social media, scroll back to the beginning. There's a learning curve that comes with social media. And actually, in the beginning, social media is what I call somebody's business card. It's about showing up enough there so that people know that you're a thing, because research actually shows that's how we look to see if a business is open. The nurses who grow the fastest are ones who build referral networks with different healthcare professionals. So we have nurses who work with pediatricians, dentists, allied health professionals, midwives, pelvic floor physios, and I'm going to teach you how to do this. How do you create that referral network where you can refer to them and they can refer to you? You will grow so much quicker than the nurse who spends, say you have 4 hours to work on your business that day. You could spend 4 hours making the most beautiful Instagram reel, or you could get out into your community. Where are moms? Where are health professionals? And build those relationships. They'll grow faster actually than the ones who just focus on Instagram. With time, social media will 100% become a source of clientele for you. But in the beginning, actually leaning into building community with families and with health professionals is a better way, I think, than just Instagram. So it's no biggie if Instagram's not your thing. Plus, I'm going to teach you. I want you to get better at Instagram, and we have like a full branding team, a million different templates. You make something and you're like, is this not good? Send it to our team. We'll look, we'll help. Like, there's just so much support there.
I also noticed, because I was going through looking for different people in the Mama Coach to
Yeah.
see what their social
Yeah.
media looked like. I was actually starting at your website. I really like how you have that search function for families to look for somebody local, and it had nothing to do with me finding somebody's social media to find them.
That's right. If they want feeding support, they go to the website and they book and pay. The money lands in that nurse's bank account, and that automatically triggers her electronic medical record to send the waiver and to send the intake form. And one of the questions is, where did you find us? Where did you find me? And often it's a mom's group. My pediatrician friend's sister used a mama coach in California and said that there's ones all over. Referrals come from all directions. It's just about finding ways to let your community know you exist, which is such a big part of training, because that's the new part of nursing, like in private practice. Like, we're used to going to work and here's your assignment, versus working independently, you create your assignment. That's a big part of the teaching, is figuring out that piece.
I like too how you mentioned like scroll back in my social media and look. It's the same for me. And I really
Right?
enjoy that for like most people out there, it is the same. You can go way back and see what we were doing at the beginning, and you just keep doing it. You just show up differently, a little bit differently, learn a trick, and it just evolves with time. You don't have to be perfect right away.
That's right. And I think it's about not comparing your beginning with somebody else's middle. You're just starting and you're going to be slower, but you're going to be better in 6 months. It's going to look better, and you're going to even talk about your business better, and things get easier as we practice. That's what the mentorship piece is practicing, getting out into your community and getting going with your business.
You brought up a moment ago a word. You said referral, and that gets associated a lot with a multi-level marketing. So can you just clear the air on that with the program?
Yeah, you know what? Because sometimes I think private practice nursing is a new thing, right? So I think people see what we're doing, and sometimes I get emails like, are you a pyramid scheme or a multi-level marketing? No, we are a license-based business. So what that means is you purchase the license to use all of the programming, your website, your EMR, legal liability waivers, the training, ongoing support, everything. This is about your practice. There's no making money from signing up more nurses. We are all bound by our own licensing body as nursing. This is professional business. It's your practice and my practice and her practice. They're separate. We just share the brand. And what I mean by referrals is professional referrals. So you would go, like, for example, to a pediatrician's office and say, hey, how do I refer my clients to you? If I see a mom who has a baby who's jaundiced, or if I see a mom who has a baby who has an oral restriction or a thrush or whatever. Can you tell me your process? And then they'll share. And then you say, hey, would you be willing to refer to me? I can help you. I know you only have a 10-minute window to check all the systems on that baby, yet families have 100 questions. I can fix that. I can bridge that gap for you. Like, we have nurses who rent space from pediatricians and they see clients there. That's what I mean by referrals, not like referrals into the business. I appreciate you bringing that up.
I think it's just something common with nursing because we're so used to the large acute care network that fear the unknown and being like, this is too
100%.
good to be true. You've definitely covered a lot of this throughout, like the different ways your practice can look, a day in the life and like the salary of a nurse who works with the mama coach.
So it varies depending on what their goal is. So most nurses are working when they start this. So it's not something you quit your job, have to. Some nurses choose to, that's up to them. They work and then they build their practice on the side. And then what happens is it grows and then they get busy in both and they get to make a decision. Do I want to scale back or quit? And I would say that's often the goal. How long does that take? Some nurses do that in 9 months. Some do it in 3. Some, to be honest, never do it because it really depends on the nurse. We have nurses who set goals and exceed them way quicker than they anticipate. And from time to time, nurses decide that this isn't for them. It doesn't happen very often, but it's always for the same reason. They'd rather be employed. Nurses who love this and thrive want the autonomy. They want to work independently.
All right, here's another one from Instagram. Sleep coaching is so nuanced. How do you blend science and heart when working with moms?
Everything we do, I describe it as evidence-based with guidelines and then a huge dose of empathy. This is where the coaching piece comes in. Everything we do, it's whether it's sleep or feeding or potty training or what have you, it starts with an assessment. Step 1 is listen. It's not us telling somebody this is how your baby should sleep or this is how you should feed your baby, or it's you tell me what's your goal, what's your challenge. And then we do assessments that determine, can we walk beside this family and help them figure it out using education and support, or do we need to refer them to their pediatrician, their family doctor, dentist for an oral release, like something. That's what it looks like. It's looking at everything through the lens of a nurse. And I think part of being a nurse is that huge piece of empathy, and nothing we do is cookie cutter. It really depends on what that family's goals are.
How do you know what you can and can't share to avoid legal issues, like as far as giving recommendations?
That's a really good question and a big part of training. How do we work within our full scope as a registered nurse? It's an entire process. So it starts at the beginning. So informed consent is an important part of private practice nursing. So we are really clear before we work with any family, this is what the service is and this is what we provide. We do not diagnose. We do not provide treatment. We will teach you and support you and refer you if needed. It's like setting clear boundaries and parameters right out of the gate. So that's all done legally and automatically. Like it sends when anybody books a session with a nurse through their website. Here's an example. I'm seeing a newborn client and I get to their house or I meet them online and I'm like, oh my goodness, that baby is so jaundiced. Or, oh my goodness, that mom has thrush. I don't say to them, you have thrush. Here's the diagnosis. You have thrush. Here's the diagnosis. You have mastitis. Whatever it is, I'm going to share with you, this is what I see. This is what I hear from you telling me. This is what it looks like it could be. And this is typically what treatment is. The next step is I'm going to make sure that I refer them to a provider that understands breastfeeding medicine or understands constipation if it's a toddler with potty training, so that that loop gets closed easier. Never once did I say, this is what it is and this is how we treat it, because that's overstepping, right? That's not within our scope. It's different for nurse practitioners who do this. The informed consent piece looks different depending on what her scope of practice is and where she lives. It's just about communicating with our clients, and then documentation at the end is the icing on the cake.
We chatted a second ago about how you are in the middle of a cohort studying up. If perchance somebody's watching this and you don't have it open, would the link link that I share still be available to them to apply and find out more information from
Yeah,
you?
yeah. So we have a few spots left for October. Anybody who's interested, I would urge them to apply. Let's have a conversation, right? I'll send all the details and then you can book an interview. And the interviews are done with me. I like to meet everybody, obviously. And then we'll figure it out if October will be a fit.
Carrie, thank you so much for being here with me. I really appreciate you sharing everything with the Nurse Fern community about the Mama Coach. I am really excited for everyone to learn about you.
And I appreciate you sharing this opportunity with nurses who are looking for something that is different. They're ready to be self-employed.